Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Should patients be forced to pay to see a GP or for a visit to A&E to ease the financial pressure on the NHS? It's a controversial subject, but one that some feel should be considered. Well, just 100 miles off the south coast of England, the Channel island of Guernsey has been doing just that for decades, with islanders paying for many aspects of their care. But critics say it can deter people from seeking help. Our health editor Hugh Pym has been to Guernsey to find out more.
So that's 117.35.
A card payment machine in a hospital. Yes, it does happen in one part of the British Isles, here at A&E in Guernsey. You see the list of charges when you arrive, £49.50 during the day, more at night, and extras for minor treatment. There are ambulance charges too. 25% of the service's running costs come from patient fees, and it operates on land and sea. This marine ambulance service mainly covers the smaller islands around Guernsey. Local people can either take out an annual subscription or might have to pay hundreds of pounds to be picked up and taken to hospital. That subscription, less than £1 a week, is like an insurance policy. If you don't have it, the service says it won't demand an upfront payment.
Payment is never mentioned as part of the clinical care that we provide. They are sent an invoice within a couple of weeks following their use of the ambulance service, and they normally then settle by whatever means they will wish to settle.
For a GP visit, it's £50, and this doctor thinks that's fair for patients.
I think there are enough safeguards to ensure that people go when they really need to. I think inevitably payment for a service does make you think as to whether you really should be going.
Some residents pay for medical insurance. Anyone on benefits has their health costs covered by the state, though pensioners and children are not automatically exempt.
I had an accident at Christmas and I had to go to A&E, 170 quid. I just cut my toe. That's a lot of money.
There could be a reduction for pensioners because it is a lot of money out of your pension.
You can get to see a doctor with 1 or 2 days of notice, and the hospital's first class, yes.
You do have to pay for a GP and A&E, but not ongoing hospital treatment and operations. Local politicians are now worried that people on low incomes might delay seeking timely care.
I think that for those people who are just above that benefits threshold, they might not go to the GP early enough, and that might mean that when they do present, things have got worse, and then they have to be treated in the hospital environment by specialist consultants.
It's an island community relatively well off, with a population of just over 60,000. That's equivalent to a medium-sized town in the UK. So it's hard to draw obvious conclusions about what the NHS might learn from what happens in Guernsey.
The real risk of charging is that we don't raise very much money, we increase the administrative complexity, and in fact people with really important healthcare conditions are deterred even further from going to see their medical practitioner when they really need the help.
If anyone wants to see a charging model, it's here, but politically it's not even on the horizon for the NHS. Any party advocating it might find its electoral chances are rapidly sunk. Hugh Pym, BBC News, Guernsey.
Ministers have angrily denied reports that a chronic lack of funds for the NHS and social care is linked to an unprecedented increase in what they call excess deaths. 2 research papers published today say that relentless cuts could be behind 30,000 deaths in England and Wales in 2015, claims which the government called a triumph of personal bias over research. So, is austerity to blame, or is it just a normal spike in the figures? Our health and social care correspondent Victoria MacDonald has the story.
January 2015 and hospitals were struggling. There were patients lying on trolleys and corridors, ambulances were queuing up outside A&Es, beds were full. That winter also saw the biggest spike in deaths in England and Wales for almost 50 years. 30,000 extra deaths. And now researchers are asking if they could be linked to cuts in health and social care.
It was a mild winter, and the pattern of mortality, with a very large spike in January, did not look anything like any previous flu epidemic. It didn't match with the reports of flu from general practice, and it didn't look like what was happening in our neighbouring countries. So then we began to look at other causes. It wasn't a natural disaster, we hadn't experienced that. So we were left with looking at the health and social care system.
Herbert Miller's family certainly believes it was cuts that led to his death that January. An inquest heard that no nurses had been available to monitor the 86-year-old. A healthcare assistant was instead asked to help him and 7 other patients and was not there when he fell.
He was such a family-orientated man. He loved to have his family around, and you know, he was 86 and he still insisted that he wanted to cook Sunday dinner for us still. You know, that's the kind of man that he was. You know, and we've lost all that because of the hospital saying that they're short-staffed. It just worries me how many other people have died in this way.
In January 2015, NHS performance worsened markedly, the authors say. Targets were missed for ambulance call-outs and A&E waiting times. Waiting times for diagnostic tests and consultant-led care increased. Operations cancelled for non-clinical reasons rose. Delayed transfers for care peaked, leading to a shortage of beds. Staff absence rates rose, and more posts remained empty as staff hadn't been appointed. The authors say there does need to be more research into any link, but the response from the 2 governments today was scathing. The Department of Health in England said the report was a triumph of personal bias over research, that every year there are variations in excess deaths. While in Wales, they said, there have been no cuts to health and social services.
Victoria MacDonald with that report.
I've been getting away with it